Hey, Nurse Megan. How are
Hi.
you?
Hi, how are you?
Hey, I know we talked about pseudoephedrine earlier, and I just kind of wanted to tell you what I learned.
Yeah, that'd be great.
Great, I'm glad you got some time. So, it's an oral decongestant. Um, there's a couple different ways you can give it. Orally through a tablet, extended release. It can also be given in solution. Um, Probably everybody knows this drug. It's also known as Sudafed over the counter. So this works by stimulating the alpha adrenergic receptors in the nasal mucosa, constricting blood vessels, and then reducing the mucosa size so that drainage and better airflow can occur. You're going to give this to patients who might have nasal congestion from a cold or something like that. It can also be used with otitis media to relieve that pressure and pain from the infection. So one thing you want to watch out for, this is often packaged with other drugs, so you'll have like a pseudoephedrine NSAID combination, and it's also really common OTC. So we need to check with our patients to make sure we're not having any doubling up of medications, so things that contain both NSAIDs or acetaminophen or pseudoephedrine. It has a maximum daily dose of 240 milligrams, so pretty easy to reach that toxic level. So it doesn't take long for this to reach peak levels either. It's about 30 minutes, 30 to 35, 45 minutes. So a couple things you're going to want to watch out for. Since this is essentially a stimulator of the sympathetic response, we want to watch out for patients who have hypertension, patients with like glaucoma, patients that might have coronary artery disease or other heart issues. Also, patients with like an enlarged prostate or urinary retention issues already, because it can exacerbate all of those effects. Some adverse effects from this med include rebound congestion after you're done taking it, anxiety, dizziness, insomnia, palpitations, and arrhythmias, a lot of common effects with those sympathetic stimulating drugs. You also want to watch out for people who are on like MAOIs or SNRIs, or other antidepressants. These can interact pretty poorly. It's generally not recommended to even take them if somebody's on an MAOI, and you want to wait about 2 weeks after MAOI use before you try this drug. It can also inhibit antihypertensives, so for those patients that do have severe hypertension, this isn't recommended. And it can also exacerbate or rather amplify pressors. So if somebody's on a pressor, you're gonna want to watch blood pressures. Definitely for patients with severe hypertension, severe coronary artery disease, it's just not recommended we use this. Do you have any questions?
So, if I had a patient on labetalol, I wouldn't want to suggest giving a pseudoephedrine.
Right, since labetalol is an alpha beta blocker, you're going to have compounding effects where this might reduce the effectiveness of that drug. So you're going to want to try maybe something else aside from pseudoephedrine.
Awesome, thank you.
Yeah, no problem. Thank you for taking the time.